Well, good morning. Thank you all for joining us for one of the final sessions at Conference Board here in 2018 in New York. My name is Adam Johnson. I'm the president at Compass Professional Health Services. Tremendously appreciate you joining us. Our goal today is to cover a handful of topics, but more than anything, we are really focused in on talking about how buying healthcare for individual healthcare consumers has just gotten incredibly complicated in recent years. And thus, we'll talk very specifically about how we think about buying products in America today just really doesn't apply to healthcare all that well. In just a couple minutes, I will introduce our friend here, Jeff Brands from OneGas. But before introducing him, I want to set the table with just a handful of things and talk about how we've found ourselves where we are with the complexity of healthcare today. So first, healthcare consumerism has been underway for a number of years at this juncture. And healthcare consumerism was really born in the healthcare cost transparency space. And as we think back to that opening chapter of consumerism, we exposed a lot of information to people, we gave them access to pricing, and yet the fundamental challenge was, well, very few people used it, very few people understood it. Number two, we've given people over time access to patient advocacy. But the fundamental challenge has been the people that we've given them access to aren't really experts. They're not the type of individuals that can really solve healthcare problems. And then finally, and I'm sure you've seen a number of great point solutions over the course of the last couple days. There are powerful tools in this market today that have the potential to make unbelievable changes in people's lives. But the challenge ultimately is very few of them are being utilized, and people's ability to connect those things together just fraught with an immense amount of peril. The complicating factor, and we at Compass spend a lot of time thinking about this, the healthcare marketplace today has more complexity than it's ever had. If I'm an individual consumer trying to buy healthcare, immense numbers of mergers and acquisitions in the provider space. When I try to go and use a provider, I don't really know whether that provider is going to be cost effective, going to be a high quality option. Notably, they might refer to places that are incredibly expensive. They might have practice patterns, what we would think about as being behaviors of their practice that drive unbelievable cost. Obstetricians doing C-sections when they don't need to. Surgeons doing surgery when it's not necessarily appropriate. And then finally, prescription drugs are driving cost in every single plan all across the country. And bringing those pieces together, when we think about the world of what individual patients think about, when we do focus groups with individual patients, the story we consistently hear from them is that their world looks a lot like this. It's a world of chaos, it's a world of confusion, and an unbelievable amount of jargon that they have a great deal of difficulty navigating. And what they really want more than anything else is to be able to have the type of resource, to be able to have the type of solution that can really bring that world together and provide them with clarity. And fundamentally, at Compass, that's what navigation means to us. It's removing the hassles of healthcare. It's helping people buy healthcare in the most optimized way possible, helping them find those very, very best doctors. And for us, that solution really sits at the intersection of two things. So our solution starts on the advocacy side. We tend to start our relationship with individual members during open enrollment, help them understand their benefits, and resolve any of the bill challenges that are presented by trying to use healthcare. But then on the right side of the screen, it's really helping them buy healthcare, resolving any sort of challenges they have in terms of finding the very best doctors, optimizing their network to find the very best pricing, and ultimately resolving any prescription challenges that they might have. So with that, we want to dive into what you really came here for. I want to introduce you to one of the good friends of Compass, Jeff Brands, who's the Director of Total Rewards Compensation at OneGas. So I'll tell you a little bit about Jeff, and then we'll dive in. So Jeff actually started his career as a CPA, so he's a reformed accountant, which certainly means his character is higher than most of ours. Notably, Jeff has been in this space his entire career, focused on HR, been in the total reward space for about a decade now. And when we sat down and talked with his colleagues at OneGas, they really emphasized two things about Jeff that I'd love to share with you. Number one, an individual incredibly committed to the internal culture of their team and their organization, and incredibly involved in the broader Tulsa community. So thank you for joining us. Tremendously appreciate it. And as I get situated, why don't you kick us off and tell us a little bit about OneGas?
Sure. Thanks, Peter. So welcome, everybody. I hope you've enjoyed the conference and that this will enable you to get a few more nuggets as we close the session. So I'm with OneGas, as Peter said, And the really neat thing about our company, we have a very rich culture. We're over a 100-year-old company, but we're a brand new company in the same breath. What I mean by that is we got spun out of our parent company, who was more of a diversified energy company. We are fully regulated, so we are a natural gas utility, and 4 years ago, we spun out and we are completely on our own. So we had to redefine ourselves. Even though we had a 100-year-plus culture, we are now looking at saying, okay, what works for us? What is the design, the elements, the changes, all of that. So we are located in the Mid-South. We're in Kansas, Oklahoma, and Texas. We're one of the largest publicly traded natural gas companies out there. And we have lots of pipeline, distribution, and transmission. And our employees, they are primarily male, over 75% of our workforce. And that's due to the fact they're in the trucks, they're in the pipelines, they're digging ditches, doing all of that. So some of those challenges are, again, you've heard it many places this week, the decision makers for buying the health care are not necessarily our employees. So safety is huge for us. Our product itself could blow up an entire town in nanoseconds.
Sure.
So we want to make sure that our culture emphasizes a safe workplace.
Perfect. So final thing to set the table for the group. Obviously, you've created a benefit package oriented towards that diverse workforce. Tell us a little bit about how that benefit package is structured today.
Okay, so our benefit package, we have traditional type plans and we have consumer-driven health plans. So PPO, majority of our employees are there, but we do have the consumer-driven, and we implemented it. We transitioned from a HRA plan to an HSA this year, so that brought some new changes for us. And it also wanted us to have a lot of resources and the tools for employees to be able to understand what that plan looks like, why they might want to consider that and make that transition.
Perfect. So thinking about the hassles of healthcare, and obviously I talked about some of those. Talk a little bit about the hassles that your employees were experiencing before we really started this journey together.
Yeah, so hassles are, they're out there. All of you experience it. Employees themselves, we want them to be present at work. And so when they're not able to focus on work, there can be safety incidents, all kinds of things that can occur. We were having lots of things bubble up to our executive team. So if something didn't go well, our culture is very much of a hands-on, help the employee, put everything in play. And so when benefits are bubbling up, they're not benefits anymore. They're distractors. And so our job is to create benefits that attract, retain, and engage employees, right? So when those distractors hit, they hit in a big way, and that can affect the business operations. So our goal was to figure out how can we eliminate those distractors or help bridge that in a way that they can be more successful and have somebody to assist them so that those distractors aren't there. And employees don't know what a copay, a deductible, co-insurance. Our employees are delivering natural gas in more than 2 million people's homes. So we want to make sure that they can do that and do that well, and that when things are going wrong, that there is an advocate for them in order to be successful.
Makes perfect sense. Obviously, any organization is focused on the business it does, not necessarily just dealing with those challenges on a day in, day out basis. So we started our relationship about a year ago. Tell us about what brought you to Compass initially.
Yeah, so clearly when we set out to find a healthcare concierge, if you will, we definitely were concerned about costs, like everybody is. We have strict budgets. We are a regulated company, which means We have to go before each of the state boards. We set prices. And so there's not a never-ending checkbook, if you will. But cost was not our main driver. We were really looking for value. Value was the critical equation for us, to be able to say that we can partner with somebody that can come in more of the back office side, walk alongside our employees, the members, and to be able to really be an extension of our team. So for us, that was the primary deal. They understand our culture, they do business similar to us, and they are effective in meeting employees where they're at.
Perfect. So obviously the first part of any relationship with somebody like Compass is you have to get the product off the ground. So when you're thinking about implementing any solution, what's on your mind as you go through that process?
So clearly, when you all select a vendor, right, there's some anxiety that comes in play when you're doing that. You know, have you done the right research? Have you asked the proper questions? When the system goes live, are the eligibility feeds working? Are they able to represent your company well? All that kind of thing goes through your minds, and you want to ensure that you're not having some type of horrific story, you know. So I in a previous employer actually implemented a product, and we didn't ask the right questions, and so they did a major upgrade on the day we went live. They had tested that significantly for all their existing customers, but what they forgot to do was really address all the new customers coming in. We were one of them, as well as many others, on the beginning of the year. It did not go well, and learned a lot of lessons from that. And so that anxiety to make sure that partnership's going to work, and it's going to work successfully.
Sure, it's sitting up here in front of the audience. I think I saw every single person at the same time mouth the words no as you said that. So common sentiment. So a year in, how did the implementation process with Compass go for your organization?
So implementation for us was maybe a little bit different from some of your customers.
Sure.
We stepped back. We knew that we were going to go with Compass mid-year, and we have an annual open enrollment in the fall with a calendar year basis. And so we had to decide, okay, when do we want to bring this product live? How is it going to work for us? So we took a strategic approach to say, we're going to plant the seeds and create momentum during the open enrollment period. We had all different types of avenues of communications to work through, but we did not actually go live at that open enrollment period or even at January 1st at the calendar year. What we did was we stepped back and said, we want to make this product pop. It's really value added. It's going to give us some significant new information, ways to communicate, ways to give value to the employees and their members. And so we brought it live in February, and prior to getting there, we have over 100 locations just in 3 states. So a lot of those locations have rural populations, but several of them are more in the urban areas too. We selected 30 plus locations to hit about 45% of our location. With that journey, we brought Compass alongside to several of those meetings.
Absolutely.
And then we did some ourselves, but we hit 45% of the workforce, and that actually made a huge change, and we'll show you a little bit later in the results how creating that momentum, helping employees understand what the value was, why should I use Compass, and how do I use Compass, actually blew the book of business out of the water.
Absolutely. So final piece before we dive into some of the specifics of the product. One of the things I enjoyed hearing about is we talked about this session. I know your organization, you specifically use this 7x7 communication model. I think the audience would really enjoy hearing about that.
Yes, so at OneGas, we, as well as your companies, you know that there's no magic recipe, right? So what one employee hears may need to be told in a whole different way to another employee or to their family. And again, some of the challenges are our decision makers may not even be the people that are working for us. So we look at it in what we call the 7x7 communication model, and we have to communicate differently and across the board 7 different ways. So communications on your electronics, on your newsletters, to homes, postcards, webinars, live presentations, all those different aspects make such a difference in the uptick in the utilization and the value or the lack of value that those employees may receive.
So I want to spend a few minutes and talk about our health pros at Compass. So one of the things that's unique about Compass is the way we actually deliver our service to employers. In addition to launching iOS and Android apps with every employer that we work with, each group actually gets assigned dedicated folks we call health pros. And so these individuals are not your traditional call center type of folks. These are individuals that we've recruited from top 50 universities. We've trained them for 6 months before they're interacting with any of your employees. And by the time that they're in a position to actually be dedicated to your account, they're really an expert. They're an expert on your plan, and we support them with a variety of technologies behind the scenes. So let's sort of start at the most basic level. What impact have the Compass Health Pros had on your organization?
Sure. So you can see up here, this is actually Taylor, and Taylor is our personal health pro. So one of the really unique things we liked is that once we made the decision to go with Compass, we went on site and we did interviews and connected and talked about our culture and decided, okay, which health pro would be effective for us? So we selected Taylor, and Taylor is a known household name within our members. And we really appreciate that. She's an extension of our team. And so when she has a full team behind her, but she's really the face of our company for OneGas. And when people call in, or they may have had a critical diagnosis to a family member or even in themselves, their emotional stress level may be significantly risen. And so what Taylor and her team does is, first off, they create a really calming effect. And that's really important for us. We want that employee, that member, to feel like there is somebody there walking alongside them, being an advocate for them in a time of need. So that is something we have had testimony after testimony of how they couldn't do it without Taylor. And so that is the best compliment that we can hear as a company. And we really, really like having that approach. Sometimes we might get a call or something or a conversation, and we say, reach out to Compass. Here's how you do it. You can do it in several different ways. But at the end of the day, we always receive very positive feedback about how that journey goes.
Perfect. So talk a little bit about how that model of having a health pro dedicated to your account feels different than other options out there.
Yeah, for us it was a differentiator. So we could look at it and say, okay, how did we make a selection? There's lots of great vendors out there, right? They're in many different fields, but we felt like this was the differentiator, is that health pro model approach of connecting our members to Compass was really successful.
Sure. Final piece on the Health Pro. I know one of your key strategies is you have an on-site clinic in a number of your locations. Talk about how this model has helped in terms of driving utilization there and symmetry.
Yeah, so some of you may have on-sites, near-site clinics. We call them well-being centers. And so that's an extension of our benefits, right? And we really want to try to get our employees and their family members into these clinics. And so it's a key part for Compass to understand and know what our clinics are about, how they can refer the members to our clinics. And then on the flip side, we need to make sure that when our members are going to the clinics, that if they're getting referred out somewhere, that they know that Compass is there to assist them in that journey, make the right selections, the right providers at the right cost.
Perfect. So let's turn our attention and talk a bit about results over the course of the last year. You've been live with Compass for about a year at this point. And I'll start here, at some level basic, but this is a depiction of how people reached out to Compass over the course of the last year. Talk about how these results really met the needs of your employees over the last year.
Yeah, so again, back to more of the 7x7 communication model. This is illustrating there's lots of different ways that you can reach Compass. And in fairness, in the member portal and the Health Pro Cloud, those are newer technologies for Compass, so we definitely expect that those numbers are going to be rising as members get more comfortable reaching out through technology. So the neat thing for us through this illustration is that what may work for one may be different for another, and there's lots of different options to get the care and the service that you need.
Great. So we'll click through a couple different slides here to depict some of the broader results, and I'll move through them as you talk. But a year in, how do you think about the success of this program?
So this is really our ta-da type slide. It's a culmination for us. We went live in February of last year. So these are just 2017 results, and we had 42% utilization of the product. That blows the book of business out of the water. Our goal was to reach 20%. So we more than doubled our goal, and we really attribute that to how we launched the program and how we made the product come alive to our employees. And the other really neat thing about this is if an employee reached out, they didn't just reach out once, on average 2.9 times. So that's telling us their experience was good and they actually came back. And again, we said cost was not our driver, but through it, we were able to see that we were maximizing and getting the bang. We share our claims data with Compass. They're able to match it together and see, okay, based on their solutions for the members, did we actually have an impact? And we're seeing that on average, that impact is more than $1,000 per user.
Sure, absolutely. And then this is a depiction of some of the specific examples of working with your employees and generating savings. How do you think about these type of numbers?
Yeah, so one of the great examples that a lot of us like to use is an MRI. You might go to a doctor. The doctor is in a practice group. They have ownership in a facility. They direct you over there. It's 4 times the cost of another standalone facility. So that's one of the ones depicted is how can you actually make that difference and still get a high quality, good experience. And so that's been great for us to see.
Sure. And then this is the final depiction of what the customer service experience was in your organization. What do these type of results mean to your organization?
Yeah, so many of you have heard the Net Promoter Scores throughout this couple of days. This is actually OneGas's Compass Net Promoter Score. So what that simply means is, would you recommend to have utilization again? And we have a very high score. We were very proud of that. In OneGas, with our customers, we have 3 different call centers as well. So we're very focused on metrics and the experience for the customer. You can see that we're a plus 12 to the healthcare industry, and companies like Ritz-Carlton that pride themselves on service, we're several points above them as well.
And we've certainly always been proud of being able to generate that type of experience, and plus 83 is our book of business Net Promoter Score as well, for comparison's sake. So I want to shift our attention now and actually walk through some specific examples. And I really like this first one, and we're actually going to play a video of an individual at OneGas talking about using the service. But before we do that, if you could tell the audience, who is Scott Gentry, and talk a little bit about why this video was made.
Yes, so Scott is one of our executives. He manages our gas supply. That's a critical role in the organization. If we don't have the gas in the pipelines, it's not going to get to the customers and be able to be a product for us. So he has a lot of influence in our organization. And right about the time we were going live, he reached out to one of our employees and was explaining that he had a situation. He was trying to get surgery and it wasn't going well. So that gave us the great opportunity to say, hey, we've got this new benefit, reach out. So we'll let you see his journey here.
So I've been having trouble with my left shoulder for a while, and I started with my chiropractor because he usually can help me when I'm having an issue, and it wasn't getting any better. So I go to the sports med guy that I go to, and I go in to see sports medicine guy, and he orders an MRI, and the MRI comes back and he goes through the 3 options we have. And the one option that we were looking at is surgery, because if I continue down the path I am looking at the MRI, then I may tear my rotator cuff. So instead of having like a 2-month recovery, which I'm currently under, I would have some 9-month recovery that I didn't want to go through. So he walks across the hall and gets with the surgeon, and they put me on his schedule that day. But I haven't seen the surgeon yet. It takes me a week to get in to see him to actually get an appointment. And he won't submit the codes for the surgery until the next day. So a week later, I see the surgeon, and he comes in and he says, yeah, we need to go in and look, and we need to clean this up and do this and that. And he says, but let me tell you, we've been having a problem with United Healthcare. He said, for the past 3 or 4 months, everything we've submitted to them, they deny for up to 2 weeks. And he said, magically, after 14 or 15 days, everything will go through. And he said, the ladies in his office will be on the phone with United Healthcare for hours until they give them enough of the running around and they give up. So I said, well, you know what? We have this new service at One Gas, and I'll try from inside the company to push my way. And so the first thing I do is I get a hold of Shelly, and she says, yeah, let me put you in touch with Taylor. So Thursday, the week before, let's see, Thursday morning, I come in and I'm gonna do Smith driving that day. So I come in early to get information for Taylor. So Taylor needs, I gotta fill out the HIPAA form. She needs to know what type of surgery, doctor information, and she'll take over from there. And my surgery scheduled for the next Tuesday. And he said, the doctor was telling me, he said, if I submit my codes on Thursday morning, you're gonna be 2 weeks from that. So there's no way you're gonna make it. So I do all the paperwork, send it to Taylor, her team gets on it. On Friday afternoon, sometime shortly after lunch, she said, you're approved, ready to go for Tuesday. Yes, yeah. So I got to keep my scheduled time. I'll be out of my recovery before the weather gets real nice. I can start playing golf again. And so it was a big deal. I was thoroughly impressed, and I haven't seen my surgeon yet, but when I see him next week for my follow-up, then I'll be able to tell him how this worked and so forth. And then on Monday afternoon, I think Taylor sent me the email breaking down all my costs for what surgery would be on Tuesday morning. So it was terrific. And I didn't have to fight with anybody. I didn't get upset about anything. Everything went great. And it's a fantastic service. We all need to use it.
Clearly a very, very happy executive in your organization, never a bad thing. Talk about the impact that story had as you launched this service.
Yeah, so what we really enjoyed about that is that was actually filmed at a live webcast that went to all of our population. So they were able to see a real-time impact of adding value and having a satisfied employee right at the launch time.
Perfect. So the second example that we'll walk through is really a fairly typical one. So when I started, I talked about that snowball effect of using healthcare. And this is a depiction of that. An individual who went to a doctor, was told that they were going to have shoulder surgery. Shoulder surgery is apparently very common in your organization. Told they were going to have shoulder surgery. Everybody they talked to suggested that was the only option. We were able to make a recommendation to this individual, find a doctor that they actually evaluated this patient, and we knew behind the scenes this person was uniquely unlikely to do surgery. Turns out that's exactly what happened. This person ended up saying, you actually don't need to have this surgery. There's another path you can go down. We're not buying a cheaper surgery there. We're not saving $5,000. We might be saving $25,000. Talk about that type of experience in terms of what that means for you and your employees.
Yes, so that's again, back to value. Are we getting what we're asking and paying for? And the engagement factor, the employee comes back to work, their mind is no longer in a stress zone, and they are hopefully engaged in their workplace and appreciating the benefits that they're being provided through the organization.
Perfect. So as we wind down before we take some questions, we'll definitely have time to take some questions from the audience. I want to ask you two final pieces. So first, obviously you've been live for a year. What are you telling your leadership team about this program?
So I guess to sum it up, we're telling our leadership team it's working. You know, it simply is working. We're getting testimony after testimony. In fact, just last week we have stand-up meetings with my team periodically. We were mentioning we were coming out here, and a testimony just ad hoc was presented right then about what happened with her husband. So with our CEO, with our CFO, they're interested in, you know, are we getting the bang for the buck? And are employees appreciating what we're providing? So we are now able to show, it's been about a year, so we're able to actually show some real numbers. The utilization numbers are blowing away our goals. That's always a great thing to be able to show your executive team.
Sure.
And just from a standpoint of, you know, we didn't have to hang our head low and say the results didn't come in to where we expected. We blew our results out of the water, and that was a fun thing to be able to tell them.
Absolutely. So final question for you, for me at least. Obviously, as you think about, we've got an audience full of people that are probably thinking about different navigation solutions. You know, what would be your final piece of advice to them as they think about making decisions like this?
Sure. So there's great products out there. There's an exhibition hall down the way that's got every kind of thing that you could think of to provide. So you have to really narrow down and say, okay, what is our company culture like? And how do we partner and create an extension and have that vendor partnership relationship in a way that is a win-win? And based on that, you know, we looked at it and said, okay, for us, the differentiation was the Health Pro. We were solving for removing the hassles and creating the advocacy, the assistance, and trying to make a little bit of clearer space in times when employees and their families can get frustrated. Another nice feature, many of you may find yourself parenting down and up in the sandwich generation, and this tool, this service, actually can provide assistance with aging parents as well. They didn't have to be in your household. So that's been another great testimony that we've heard from many employees is, you know, I'm working both sides, and I've got needs with my kids breaking an arm, and I've got needs with my aging parents and how I care for them and what services are available.
Perfect. I can tell you my own Compass Health Pro sees plenty of the sandwich generation for me, I can assure you. So with that, love to take some questions from the audience. Happy to take anything you've got. Please.
Your business model for the Health Pro, I just want to make sure I understood, then ask the question, that it's typically you hiring people straight out of school, training them, right? And then they give them the tools and the team. That's the picture, right? So what's the business thought process behind that versus the other direction of hiring people who have many years of healthcare experience in similar roles, not quite such a nice modern product like yours, but had similar roles in dealing with these types of things over many years. So I'd just like to understand that.
Yeah, so I'll answer that in two ways. So first, we actually used the model you described originally. We had a tremendous focus on, we wanted to hire people with a lot of healthcare expertise that had been around the industry for a long time. And the challenge that we found was, well, you know, the healthcare sector has this Net Promoter Score of +11. Every single person that came from that world grew up in that type of structure. And so the paradigm that we wanted to use with respect to employees didn't necessarily match. I think number two is, you know, we're in the business of really trying to guide people through, I have this healthcare, could be healthcare crisis that's going on in my life. what do I need to do about that? And so we went out and looked at a lot of different folks in healthcare, and quite frankly, just didn't find people that had that type of expertise. And so we really decided that the best way to achieve the end that we wanted, which was we want it to be an incredible experience. We want them to be able to be guided and directed and really wrapped in this cocoon of support. We would have to build that ourselves. And so being able to take individuals that are really, really bright, that are impactful, that are empathetic. We hire about 4% of the people that apply for jobs at Compass. When you take that type of deliberate approach and then you supplement behind the scenes with technology that allows us to put at their fingertips a lot of insights about the plan, about the market that they might be in, about any number of the ancillary benefits, that's where we've been able to get that wow factor. And I think a lot of the reason that we lead the industry in Net Promoter Score is because we've done that and we've gone, I would say, done the hard work to build a model that's successful specifically for what we want to achieve. Perfect. Additional questions?
I'll ask another one.
Please? Go for it.
So in the video example, the testimonial, I forget the guy's name, sorry, but
Scott Gentry?
Scott, so the good testimonial, Scott. I would like to know, so behind the scenes, what are examples of what Taylor is able to do to get that result? So how did she get that answer on Friday?
Sure. So I think a lot of that gets to the methodologies that we've written internally. You know, we've got expertise both from the provider side and from the carrier side inside of our organization. So we've built workflows that look at, for this particular outcome to happen, and we're a very outcome-focused organization. We want the outcome of this particular person is set up with a doctor that we would want them to have surgery at. And that's an important piece of the story that isn't necessarily told by Scott. To the extent that he came to us with a doctor that we would have said was low quality, wasn't cost effective, we would have actually steered him away from that type of circumstance. But to have the technology and the tools that from the outset to be able to say, this is a great provider for you, this is actually someone you should go to, we feel good about the outcome you're going to get. That's step one. Step two then is, all right, can we actually get this approved? And a lot of that process is simply knowing what has to be done, what type of information does the TPA need in order to approve this, and then you just got to be really tenacious about it. And I think what Taylor did there that was successful was, from the outset, she knew for United Healthcare to approve this, we need to have these 4 things come through. I'm going to go out, I'm going to assist that provider's office in getting the outcome that they want. They want to do this surgery as quickly as they can. Let's help them gather the right materials, and then let's get them to them as quickly as we can. Let's follow up as we need to. Let's collaborate with the employer. Let's collaborate with the plan to the extent that we need to. It's a very hands-on approach to making sure that it happens and making sure that we can represent that member the way we want to. So I think that answers your question, but it's really both sides to have both sets of methodology to achieve it.
I'll add to that. We want our vendors to work amongst one another. So we have many different vendors just like you all do, and making it all work is a challenge, quite honestly. But we have spent a lot of time with Compass and, in this case, United Healthcare, to really form that relationship and make sure that those connections are happening and that they're happening at the right time. We have examples of appeals, for example. Somebody has a frustration, Compass will help with the appeal. They might have to reach out to United Healthcare, understand things further. But you know, in this video you saw, the doctor's office clearly tries to say the big bad insurance company. We know that's not always true. And,
right.
So we're trying to bring them all together and to work effectively amongst all of the benefits that we deliver.
And I do think that collaborative approach is incredibly important. And I think there are vendors in this space that would agree with our approach there. I think there's vendors in this space that have a more combative approach. And we actually think that collaboration is really important to getting those type of outcomes. I think we have time for probably one final question, and then we can call it a session. Please.
Thank you. So you mentioned that you recommend providers based on quality and cost. How do you identify those providers? Do you have an ecosystem of providers that you vet, or do you work within the employer's network of providers to identify those recommendations?
Sure. So we are not a narrow network solution, to be clear. So we do not bring our own network to bear. I think one of the things that's worked well for Compass is being able to work with any carrier network out there. But we support national employers. So we have clients that are the size of one gas. We have employers that are 50,000 people that are all across the United States. And so we've cultivated our own data set that has quite literally billions of rows of claims in it. And we've studied those claims to understand what is the transaction price of every provider on every network. When those doctors actually see particular patients with given diagnoses, what do they do? And that gets to that notion of, I've got a pregnant patient. Is this a path that's going to a C-section? I have someone who has shoulder pain. Is this doctor going to take them down the path of surgery, or are they going to try to steer them more down the path of something like physical therapy? Behind the scenes, while we certainly would approach you as being a concierge-empowered health advocacy kind of program, at core, we're really a big data engine behind the scenes that's studying that entire market such that when your individual patient comes to us, we can definitively say to them, in your market, with your network, this is a provider that's going to treat you well, is going to guarantee you an absolutely fabulous experience, is going to have a good outcome, and at the end of the day, the financial experience about it is going to be as good as it absolutely can be. And I think it's that full. All of those things have to work in synergy for that to be able to work, but that requires a proprietary data set that, quite frankly, no one else has. The type of data that we have. And we've supplemented a good amount of that data with interviews that we actually do of providers across the country. So last year we actually interviewed 250,000 providers across the United States to understand very specifically how does their practice run. And some of that's simple. I mean, it's questions like, are you actually taking new patients? And do you see people with these particular types of conditions? But it gets much more involved. It gets to the level of, there's the concept of something being a patient-centered medical home. We get into the details and understand, are you really a patient-centered medical home? Are you actually proactive? Are you closing gaps in care with your patients? Collecting that type of data, you can't buy that data anywhere out there. That's data you have to be able to collect, and then we use that on behalf of our members. Perfect. All righty, well, tremendously appreciate all of you joining us today. Jeff, appreciate you taking the time as well. Thank you all. Hope you enjoy the rest of your conference.